And let's head off to Anneliese Dressel, who joins us from the Health Hub, Times Square in Ballincollig. Good afternoon to you, Anneliese.
Good afternoon, Patricia.
And you're very welcome. Let's get straight into questions. Hi, Anneliese. Last week you advised using, is it L-lecithin for high cholesterol?
No, so L-theanine is an amino acid that's very good for calm and focus. So for high cholesterol, I would have recommended either the red rice yeast, which is does the same job as the statin drug, but seems to have far less side effects. Or if you can't handle that, some people very rarely, but some people can't take that either because of muscle pain. You can get something called plant sterols, and they're the things that you find in the fluoroproactives and the Benecols, but you need at least 1.6 to 1.8 grams a day. So it's much easier to take in a tablet, and the best one on the market is Zero-Col for that.
All right, because this listener said the L-theanine that she took your advice on board, but wasn't happy with the soy L-theanine, as it might affect estrogen post-menopause. And she's wondering what you think of the sunflower version. Yes,
okay, so this is lecithin actually.
Oh, lecithin, sorry.
Yeah, Lecithin. So this is kind of like a phospholipid. Look, I mean, it's very much down. I'm not a believer that soya is dangerous to take, particularly after menopause. I think it's a wonderful product to take after menopause because it does have some plant-based estrogens in there. And if you actually look at all these cultures where they eat a lot of proper soya products, I'm not talking about like GM soya yogurts and soya milk, which are very processed and also have been genetically modified. I'm actually talking about, tofu and tempeh. These things they have in Asian cultures, they've actually a far less amount of osteoporosis than we do. So I think that, they get the protective effect from the plant-based estrogens in these products. So I wouldn't be very worried about it unless there's a major family history of cervical and breast cancer. But the sunflower lecithin is just as good, works equally as well, but you're going to be paying a premium for it.
Okay. Hi, Anneliese. Could you recommend, please, a good vitamin D tablet to take while taking the following meds? I'm on a statin, a blood pressure tablet, and I'm also on aspirin, and I'm on a Prolia injection. I don't know what a Prolia injection is.
Prolia is for bones. So Prolia stops the bone cells that break. So our bones are always being remodeled, Patricia. So you've got cells that break bone down, and you've cells that build bone back up. So that Prolia stops the bone from those cells from breaking it down. But you do need to ensure that you're building your bone because it does need to, rebuild in order to stay elastic so that it can resist shocks and not shatter. And it also needs to remineralize so it stays nice and strong and dense. So I think it's best to take a combination of vitamin D and vitamin K together. The vitamin K can prevent that. So if you've got too much vitamin D, it can increase calcium absorption, and calcium can harden the cholesterol and arteries, and there's plenty scientific clinical studies and evidence to show that that's the case. So I'm not a big fan of taking high doses of calcium. I'd much rather see people get calcium from food and then take a vitamin D and a K supplement. So it's hard to say how much vitamin D you need because really everybody is very individual. I think 1,000 IUs is a very good daily dose for most people. But what I would always recommend is that somebody takes it for 2 to 3 months and then actually get your vitamin D levels checked to make sure that you're getting enough. It's not possible to know unless you have a test done. And then the vitamin K with it will prevent it from hardening the cholesterol and arteries, and it'll also actually help to get it into the bone, the calcium into the bone where it needs to be. So that's what I would recommend. Don't go for the high dose vitamin D, 1,000 IUs, and take a vitamin K with it as well.
Okay, and you are a firm believer in the vitamin D clock change to clock change because we just don't get enough sunlight.
Absolutely, Patricia, and this year we had a terrible summer, really. So I would even have said to people when kids were going back to school, start them on it. Plus the other source, which would be animals, if they're outside in the open air, they will be making vitamin D in their skin, and that'll be transferred into the egg yolk and to the milk because it's a fat-soluble vitamin. So most of our animals are still out now, so if you do take plenty of those products, you probably will be okay. But definitely, usually by November, those animals are all indoors, and we're not getting it even from our food. So the only way to get it is supplement.
Okay, hi. Could you ask Anneliese, please? I have pulmonary fibrosis in my lungs, and it's leading to lots of mucus and phlegm. Is there anything you could recommend?
Okay, so this is like pulmonary fibrosis is where you get fibrous tissue that it's like scar tissue in the lungs. So it's part of what they call COPD. And really, it's all about managing your condition. So there's nothing really that can kind of help get your lungs that, fix that scar tissue. So it's about preventing further damage and trying to minimize the amount of mucus in your lungs. So there's 2 products I would recommend for that. One of them, and they're both Dr. Clare products, we have them here in the shop. One of them is called Clear Away Tea. It's actually a tea full of herbs that are really supportive for lung tissue health. So they'll keep the lung tissue that you've got there stay healthy and, renewing and managing to be as healthy as possible. And then take something that will that will reduce the mucus in the lungs, because that's where you can kind of get infection happening and a lot of congestion. So for that, I love the Dr. Clare Congestion Blend. But you might want to try and see which one suits you best, because she also does one called Mucotone. Now, that's a better one if you're prone to a lot of infections, because there's immune-boosting stuff in there, whereas the congestion one really is all about drying up the mucus. So you might even want to, take one day and one the next to support your immune system. And then her Clear Away Tea, and I would do that every single day preventively throughout the winter months for sure.
Okay, hi, Anneliese. Would you recommend CBD oil for anxiety and headaches?
So yes, definitely for anxiety and possibly for headaches. There's lots of reasons that people get headaches, so I'll talk about that in a sec. But in terms of anxiety, the cannabis oil can work really, really well to help you feel calm and focused very quickly. It doesn't work at the root of the problem, but it just does manage your symptoms for you. So it's a great one to take if you know that you're going somewhere, or you have something on in work, or anything, if you have to give a presentation or anywhere where you feel you might be a bit anxious, take it proactively. But if you do take it if you feel anxiety is starting to build, so if you take it immediately, then it takes about 10 minutes to kick in. The difficult thing I find with cannabis oil is that different people respond differently. So some people might need a stronger cannabis oil. It comes like in 5%, 10%, 15%. So some people might need the 15%, and some people might manage with the 5%. And then some days you might be more anxious than normal, so you might need to take it more often. But it's generally safe to take fairly frequently, and the worst that really would happen might be that you might start feeling a small little bit sleepy from it. But it's certainly very hard to overdose. So keep taking it as much as you need it. And then in terms of, what was the second bit I said to talk about in a minute? For headaches.
Yeah, the headaches. Yeah.
So headaches can be from a number of different things, Patricia. So if you're getting permanent migraines, it's definitely worth trying riboflavin, which is vitamin B2, and also magnesium. And actually coenzyme Q10 can work well. Now, this would be somebody who would be getting a lot of migraines. You take them preventatively. So you'd really want to be getting more than 2 or 3 migraines a week, because otherwise, if you're getting one migraine every few months, there's no need to take this every single day. But you take 400 milligrams of riboflavin, that vitamin B2, and that's quite a high dose. You're going to need at least 200 milligrams of magnesium, and I find the magnesium bisglycinate is the best for headaches. And then coenzyme Q10, you'd probably need about 100 milligrams of that. And for a lot of people, if they take those every single day, they find that they prevent migraines very, very effectively.
Okay, a listener wants to know any suggestion from somebody who is suffering from vertigo. Is there anything you would recommend?
So vertigo, Patricia, is where you get this feeling of either dizziness or even nausea. It's like your balance is gone. So I think it can come from 2 things. One is where there's been a viral infection that's affected the canals of the inner ear, and they become inflamed, and that affects your feeling of balance. So it's almost like being on a ship where you're kind of feeling seasick. You get that dizziness, that balance issue, and also for some poor people, they get that terrible nausea. So that's an anti-inflammatory approach, and it's hard, but these are the things that we found have helped in the past. So lion's mane mushroom is very good. You need to take probably about 5 grams of that a day. So take it in a powder and add it into a smoothie or something. Lion's mane is very good for nerve regeneration. And then we found using a probiotic with Lactobacillus salivarius in there, and a product that we have here in the shop which is called P4 Immune, which is very, very high levels of particular anti-inflammatory plant chemicals to bring the inflammation down. So that could work very well. So to repeat that, it's a combination of at least 5 grams of lion's mane mushroom, and then the P4 Immune, which is by a company I think called One Nutrition, and a probiotic that has got Lactobacillus salivarius in there. So I know BioCult has it, one of the OptiBac ones have it, quite a few of them do. And then if that doesn't work, it could be actually a structural thing. So for a lot of people, it actually is coming from neck and back pain. So if you feel that it's more to do with that, you're going to have to go to either an osteopath or a chiropractor and have some spine work done to help realign the spine. And like for me, tinnitus is all tied in with my back and neck. If it's bad, I'll get tinnitus. And for some people, it is that structural thing, but for some people, it's the inflammation of the canals.
Okay, this is one, and I imagine this is common for a number of people. It says, hi, could you ask Anneliese, please? I get very depressed at this time of year, finding it very hard to motivate myself, feeling tired all the time. What could you recommend anything? That sounds like that seasonal affective disorder, SAD, doesn't it?
Absolutely, and it's quite common, particularly in the Nordic countries as well, Patricia, where in the wintertime they could have nearly 23 to 24 hours of darkness at times. So there's two things. The first thing is make sure that your vitamin D levels are correct. And I think in this case it's very important to test your vitamin D before you start and after you start to see that that's what the problem is. You may need to take a much higher dose of vitamin D. Some people don't actually absorb or manufacture vitamin D very well. And the receptors as well. It's a genetic thing, Patricia. And so therefore some people will need much higher doses. So definitely test to see what level of vitamin D is working well for you. And you can buy tests in health shops and your doctor can test. So there should be no problem getting tests for that. The second thing then is actually what they call a light box. So you can buy very sophisticated ones now that you actually put over your bed at night, and the lights start coming on, maybe 6 or 7 o'clock in the morning, and they start increasing their brightness, and then it kind of helps with your circadian rhythm and the waking up. Some people get them and they put them next to their desk if they're working from the office or home. If they're sitting at a desk, it's very easy to have that light box next to your desk. So the idea is that the light box is mimicking sunlight and is working on those, that part of your brain that responds to the light circadian rhythm. So definitely worth investing one of those if it's a regular thing for you every year.
Okay, and it is common.
It's very common, I think, Patricia, yes, definitely. Yeah. And especially in countries where we don't get a lot of vitamin D in the summers as well if we haven't had good sunshine. So it's really like we have a test in here. It's €12.80. It's not very sophisticated. It just tells you whether you have enough vitamin D or too little. But that's all you need to spend is that. And if you're taking 1,000 IUs for a month and you still are testing at too little, you're probably going to need to go for 3,000 IUs every single day. I normally wouldn't recommend that to anybody unless they know they need it because of that increased risk of heart disease with it.
Okay. All right. We'll leave it there. Listen, have a lovely week and we'll chat to you again next Monday.
Thanks, Patricia.
Thanks, Anneliese. And Anneliese puts up all of the items that we've spoken about today. She puts it up on her website this afternoon, which is healthhubstore.com.